Welcome to Knovva Academy. My name is Alex Krasser and I'm head of online learning. We're very excited to present the Pandemics and Public Health Initiative designed to help teens around the world be better informed about one of the most impactful events of the modern era. 3 months ago, the World Health Organization declared COVID-19 a global pandemic. Now, as many nations are gradually reopening, or at least considering it, having accurate information is more important than ever. What do we need to know to make the right decisions? What precautions should we still be taking? How should we expect things to change as we slowly transition into a new normal? To help us answer these questions, along with some questions submitted by students, we're very fortunate today to be joined by Ivana Shui and William Mitchell to help us sort out what we need to know. Ivana, William, thank you so much for taking the time to speak with us today. To start with, I'd love if each of you could introduce yourselves, just say a little bit about where you're from and what you're currently studying or working on.
Sure.
Ivana, start with you.
Yeah, I'm from Nanjing, China. I recently graduated from Harvard Medical School. I did my major in immunology. I performed research practice and clinical studies in MGH Cancer Center and Dana-Farber Cancer Institute during my study. And after that, I currently continue study on cancer immunology research in MGH Cancer Center. Yeah.
All right, thank you for your work. And William, how about you?
Yeah, and my name's, thanks very much for having me. My name's William. I'm a junior doctor from remote Central Australia. I've been working out there for a couple of years, and I'm just finishing up a Master of Public Health at Harvard this month. And I'll be staying over with a global health research team here at Mass Eye Hospital afterwards.
Well, I'm sure it's been an interesting semester to finish up your studies. So as our high school students are starting to enter their professional training and figuring out what they want to do with their lives, we find that it's sort of helpful to hear other people's stories. So I would love it if both of you could describe like an aha moment that led you to deciding to work in medicine or public health, or what's led you down the path that you're on.
So I actually came from a research family, and all my parents are very good at what they did in their career, in their field. And so I do have a very good background in my research training, start very early, but the aha moment only came to me, I think it's after my first lab rotation. In that lab rotation, I was doing my breast cancer research, and it was all bench-based. And one day my professor talked to me about the clinical study she's been working on, and asked me if I want to, help and shadow and just have a look what that is. And that really inspired me. We were doing target therapy clinical studies on young age breast cancer patients, and it's so painful to see some of them still non-responding to those target therapy. And so that's a time when I finally determined to discover something for them, which will have them cured someday.
So William, was there an aha moment for you that led you to follow the career you're on?
Okay. So I guess when I was a kid, I grew up in Alice Springs. I had a family that were involved in healthcare out there with the kind of geographically and socially complex populations that live out there. And it seemed like a good, worthwhile experience growing up as a kid. And so that's why I went into medical school back in Australia with the intention of moving back out there to work. So I went back out to Central Australia to work after I graduated. So I guess it was a slow burning aha moment. And coming over to do public health seemed like a good addition to to the undergraduate degree back in Adelaide. So medicine as a junior clinician, there's a lot of face-to-face patient contact, and it's very kind of, you're very close to the medical problems in that sense, I guess, and being able to take 10 steps back and shift the scope to a bigger global population kind of level, and remind yourself or relive yourself that perspective of where everything you're doing in the hospital fits in the bigger scheme of things.
So you've both experienced working in medicine in multiple countries. And so I'm wondering if you could speak a little bit about what you've seen that's similar and how different healthcare systems differ around the world.
The first thing I noticed that is how people respond to such a pandemic. And I feel like I came from an Asia background, and so the Asia community, due to their previous suffering from pandemics and some similar issues, we tend to be more cautious and more, we want to be more prepared of what's going on and what is going to happening. And I think because of Western countries have been rolling on a very smooth, developed way, and they tend to be a little bit ignorant to some issues. And that's the first thing I noticed. The second differences is how because I am an employee in MGH, and I've been deeply involved in the COVID-19 related activities. And we have, so we launched Massachusetts General Hospital and Brigham Hospital Innovation Center only for COVID-19. And in this COVID-19 center, we're working on problems such as on need on capacities and resources, and how to discontaminate those masks. These are the problems that were raised from the whole medical capacity, that was under the whole medical capacity problem, that I think we are unprepared of such a huge number of patients, no matter in health unit or in equipment or resources. That's the second thing I noticed. And I think the third thing is how people united to fight against this, because I noticed that some people, or say some students from our school, do have different opinions on should we protect ourselves, how much should we protect ourselves, and should we hang out, should we go parties, something like that. So we do hear different voices, and we're living in such a very informative age, so you get all the information all the time. Some people may respond very well to that. They can digest it and pick the information that they need. And some people may not able to do that, and they may become very anxious, very depressed about what they hear, something like that. Yeah.
I can't speak, to the American or to the North American culture as much as someone from the US can. But from what I've observed and from what Ivana just spoke of, it sounded like she was addressing a lot of kind of system-wide cultural dissimilarities between countries and how that affects people's willingness to respond to federal advice to things. And like you alluded to, and like I've kind of observed, there does seem to be a different kind of systemic population response and appreciation for for a centralized kind of government giving information to people and advising them on what they should do. One of the things that has been effective in Australia and New Zealand, down in my half of the world, has been people's willingness to take the advice of the government. I don't know how much of that's a cultural thing. I think that the size of our countries makes that a lot easier to kind of control. So New Zealand's got a much smaller population than Australia, and Australia's got a much smaller population than the US. So I think it just makes it kind of easier to get information out to everyone and get everyone on the same page. I think the fact that we're surrounded by ocean just makes it easier to kind of cut ourselves off from the rest of the world when we need to, as opposed to countries in Europe, where there's just kind of more movement of people across borders. And New Zealand, where I'm not from, but they've had a really effective response, and they effectively shut down their borders from, I think, any international travel very early on. And they closed down shops and restaurants and cafes very, very early on as well. So for weeks and weeks and weeks. And my understanding is that they've had a long period of almost no new diagnoses, and are talking about reopening things now, and talking about the concept of eradication. So not just kind of control and keeping it under the curve, but actually no new cases. And I think they've been able to do that because they're small. They could close their borders early. They had the Northern Hemisphere to look at as an example of what happens when you don't do that. And they have this different cultural trust in their government. And Australia is closer to that.
So, William, you did medicine in remote regions of Australia. And so I know you're talking about population size being one thing that's affecting how the pandemic spreads, but obviously population density is another serious issue. Even in the United States, we're seeing, New York City as an epicenter, whereas the more rural parts of the country are being impacted differently by the pandemic. So I was wondering if you could tell us a little bit more about what this might be like in more remote regions. Are they safer? If they get hit, how might it be different?
So my understanding is that with a pandemic like this, the three important things are kind of quantifying the problem, limiting the problem, and then treating the problem. And so quantifying the problem involves testing and figuring out how many people are diagnosed with the disease. Limiting the problem involves limiting the continual spread of the disease, and treating the problem involves a vaccine. In the absence of a vaccine, we're kind of restricted to having to limit the spread of the problem, and that in the absence of a vaccine, that means social distancing, and one of the things that I've noticed in America, in the US, is that a lot of and like you said, New York, a lot of parts of New York don't have the luxury of social distancing. The thing with rural Australia is that they've kind of got this automatic social distancing mechanism by being located so remotely, and that has worked favorably so far. I don't know what happens if or when COVID does get out to those communities, but when it does get out there, people don't really know how it will play out, and whether that isolation is effective when it comes to social distancing, but then ineffective when it comes to getting tested, quantifying the problem, and having access to treatment, and having access to information that constantly reminds you about how important it is to keep distance from people and to limit going outside when you don't have to.
So I would imagine one challenge would be distributing resources to the more remote areas. And that actually brings me to a student question that we have. And I will let him ask it.
Hello everyone, my name is Andy and I'm a high school student from Sydney, Australia. My first question is whether countries have the duty or moral obligation to distribute medical resources, such as ventilators, that they themselves have domestically manufactured to other countries who are in need of them.
Ivana, can we start with you on this one?
We have to set up an agreement among different countries so that people can have a rule to obey on certain levels. One, what are those resources? each country have? Second, what are those resources each country want to share or have the ability to share? Three, what are those channels? So we would like to see a rule has been set up first so that people can know what are their options and they can make their decisions based on what's going on in everywhere. So what's happening now is we're not fully transparent to what's happening in other countries. And that is a very, I would say that's a wall between what we want from different countries and what they have. Sometimes the government and even like Massachusetts government can't get the accurate channel or source, and they need to dig that out themselves. And I don't think that's a very efficient way for doing that. And it will be more helpful to fix a problem if we have a rule set up and a list to share that people can ask and put out what they want to share. It's okay if they don't want to share, but they need to, have everybody understand what's going on. And the adults will make their decision based on the rules and the clarity they have.
Where should that clarity come from? Is it the WHO that should be setting it up? Is it federal governments? Is there some other organizational body that could help coordinate that?
I think it should be an independent organization that is apart from no matter which government country and which country government, so that they are not tied to whatever responsibility they feel they need to obey to their country, so that they will educate people and encourage people to do this as an NGO or on a nonprofit way, so that there's no way anyone can solely get profit from this from doing this, so that people will treat it as an equal agreement to each one participating in this.
So I don't want to put words in your mouth, but what I'm hearing is, so going back to the student's question, it sounds like national governments should be looking after their own populations first, and the place for more international generosity might be in the more non-governmental sector.
I think you're right. The first step is to make plans for your own country and manage the things happening in your country. And the second is to work on collaboration, because sometimes you cannot fix your problem by yourself. You need some people's help.
And William, do you have anything to add?
Yeah, I think it's a really good question and a really, really important question and a really interesting question. And I think it all kind of comes down to how much a part of the world, the rest of the world, and other countries feel like they are, versus how much a part of their region other countries feel like they are. And so like you both alluded to, that nationalism versus kind of a globalism mentality. And it's really interesting because this is the virus is affecting the whole world, and the virus is affecting everyone, and it doesn't matter where it started. The fact is, everyone's kind of in this now. And also importantly, I heard someone say the other day that that the virus won't be over anywhere until it's over everywhere. So there's no point in kind of having your own kind of country safe and clear if the rest of the country is still, if the rest of the world is still in chaos, because that there are still going to be so many restrictions to your country that are a direct result of the rest of the world still being so heavily affected. So I really think that the mentality of, we're all in this, and nowhere is going to be clear of the virus until everywhere is clear of the virus is really important. And it affects things like ventilators. It also affects things like vaccinations. So there's obviously a lot of different organisations and countries working on a vaccine at the moment. But there's this kind of concern that when a vaccine is developed, there'll only be a certain amount of vaccination developed, and who gets that first. And if you adopt the mentality that the whole world is kind of affected and involved, then you could kind of figure out, okay, on a global scale, who are the most important people to give this vaccination to. So figuring out who gets access to these finite resources like ventilators or like vaccines first is important. But I think that it's I don't know what happens in the real world, but I think that this is a global problem, and we're all in this, and it's not going to be over anywhere until it's over everywhere.
So obviously, this isn't going to be over until we are able to develop a vaccine to immunize everybody. But I've also been reading that even if you've had COVID, even if you test positive for COVID antibodies, that doesn't guarantee immunity. So Ivana, you have a master's in immunology, so I'm hoping you can help explain what should we know about immunity? What should we know about antibody testing? Why wouldn't antibodies guarantee immunity? That sort of thing.
Yeah. So we know from other coronavirus that it's very likely as soon as you have gone through an infection, you will also acquire an immunity. But still, it has to be proven over time. We need studies to really see whether those people who have been infected once are subject to reinfection. There is a high likelihood there is an immunity, but we also see other cases reported that there's no enough antibodies against that. So I would talk a little bit about the science behind that. So when you're native to the virus, you have not been in contact before, your immune system responds quickly with a first response, which is non-specific. So to control the infection immediately, how you respond to that first non-specific reaction is based on the viral dose you received, your genetic background, and your immune system, which is already being programmed to respond to different infections. And these can all be affected by your general health and age and whatever genetic background that you have. So we try to make our body hostile to the virus. And just like raising our temperatures or deploying general virus eating cells, as part of that response, a part of immune system get programmed. You can imagine like software programming. This part of response is refined and replaced with a specific response. So the specific response tries to completely cure the infection. And most of the time, this can be done to yourself. And this is where the antibody was produced. So this part of immune response is called adaptive immune response. So there are two keys of adaptive immune response, T cells and B cells. B cells are responsible for memory, so they produce antibody that are already specific to this pathogens and allows them to quickly bind with the surface on of the virus and stop their replication. So that's why some people have managed their own virus symptoms. Is there a way to use their antibody to treat other people's symptoms? We don't know yet. because in theory, the case is simple. The antibodies are proteins produced by the immune system to target virus, and they destroy the pathogen. If the antibodies are ready and waiting, your immune system were getting it faster, against it faster. But in real practice, things are sometimes not simple. Some people who've been infected with the virus once were not being able to catch infection in the second time. We do see that there is no 100% guarantee here. And a lot of people are working on different types of vaccines. So we are making sure that we have multiple shots on the go. And eventually we're gonna pick the best one of them and try to get that channel and distribute to all the people that they need.
All right. Thank you. Thank you for explaining that. So we're hearing a lot about COVID patients and people who are having to be on respirators. We're hearing about the extreme cases. But I've been seeing that there are a lot of people who are asymptomatic. Is it unusual to have a disease but be asymptomatic? Are asymptomatic people less contagious? Is the virus causing damage to asymptomatic people's bodies that it isn't responding to, or is the virus just sort of hanging out? There's a lot of questions, but could you talk a little bit about what it means to be asymptomatic?
I think it's unclear whether having a stronger response will leave you any better off. So the incubation time for COVID-19 is 5 to 6 days. So that means in that 5 to 6 days, you might have unknowingly infected with coronavirus. And you have some mild symptoms like fever, dry cough, fatigue, loss of appetite, loss of smell. These are all symptoms that you do not notice very often because it's your immune system's helping you against this virus, and your immune system don't want to scare you off, and you don't have that alert systems right there to react to these symptoms. And some people do have a worsen symptoms rapidly after that. Some people don't. The differences are just like what I said. Some people do have different genetic background. So in that genetic background, they are programmed to have an immune system against some type of virus. And second reason is that they might have been exposed to certain types of virus before. So they do have an immune response against certain types of virus. And that kind of response may help a little bit. So some people, they see this virus for the first time, and their immune system don't know how much force should they use against this virus. They act too drastically and erase cytokine release syndrome and stroke that might cause a very severe symptoms and eventually end up in the ICU. And when you are under control of that adverse effect, your immune system will adjust yourself to a certain way to control this virus while make sure that you are in a good condition as well. So it takes time. Some people do have that ability to wait until their immune system find that balance. Some older people may not have that ability to wait until their immune system find that balance, and they unfortunately suffer from this.
William, do you have anything to add?
Yeah, thanks, Ivana. That's much more complex than I understand. My understanding is that the virus isn't the thing that causes the symptoms. It's your body's own response to the virus that causes the symptoms. And I guess the relevance of people who don't show any symptoms are that they're in a way the most dangerous people. And they're typically young people like me. I'll include myself as a young person, and other kind of people about my age and younger. If we get infected, we're probably not going to show any symptoms, and that makes us really dangerous because we then become part of this reservoir or this body of people walking around the street with the disease without knowing that we have it. Then they don't think they're sick because they don't feel anything. They're just giving the virus to other people, and the reservoir or the body of people with the virus continues to grow. And it's about, when little old Jane, who lives up the street and is 90, finally gets the infection, and she can't handle it because she doesn't have the same, strong body that you have. That's when it becomes a problem. So that's why social distancing is so important for us as young people who don't have any symptoms, because we're going to be the reason that the virus continues to spread and continues to exist. It's not going to be the people with symptoms.
So if I'm understanding this correctly, it's not that an asymptomatic person isn't responding to the virus, it's that they are responding at an appropriate level to the virus?
So I guess symptoms are subjective. And so, you as the patient kind of decide whether or not you have symptoms. So if I have a little tickle in my throat, I might say I have no symptoms. I don't feel anything. But for someone else who has that same tickle, or maybe a little bit more, they might say, oh, I've got a sore throat. My understanding is that it's not about how appropriately your body is responding. It's just about the level of response. So there's not kind of a good and a bad. There's just kind of like a level. But people who are asymptomatic, that's not because they have an appropriate level. It's just a different level of response.
I think one problem is because we understand what are COVID-19 related symptoms gradually. We first thought it was only respiratory and only fever, cough, and shortness of breath, and some certain level of pneumonia. But it came to us later. We realized that there's some neurological symptoms like muscle weakness, loss of smell, inability to taste, and some numbness, some dizziness, some confusion, severely like seizures and stroke. But when those mild neurological symptoms happens, you don't often feel it's a matter of disease. You feel like fatigue is like, I watch too much Netflix, and sometimes like something like that. You don't think that's a disease related problem. And we do find out that there's some GI related symptoms, like you have vomiting, nausea, and abdominal pain. You don't overly relate that to respiratory virus. So I think some people say that they are asymptomatic. Part of them don't know, part of them not sure.
Thank you for clarifying. So we've been talking about what's going on inside the body, and I'd like to zoom back out to global responses to pandemics and global preparedness for pandemics. And that actually brings me to a student question that we have.
Hi, my name is Sana, and I'm from Lahore, Pakistan. And my country has been in a government-induced lockdown since February 15th to help minimize the spread of COVID-19. Due to this lockdown, around 60% of Pakistan's population has been unemployed and starving. Therefore, my question to you is, how can the government and the general public better prepare for future outbreaks and pandemics?
It's really sad to hear about countries like Pakistan that have so much of their population affected. I'm really sorry. two of the things that can be done that have worked this time have been international collaboration between teams, so teams working together and teams sharing information they have with each other. I think it was Yuval Harari who said once that the difference between humans and the virus is that the virus in China can't give tips to the virus in the US about how to best infect people. But people in China can give tips to people in the US about how best to stop people getting infected. So making sure we do that, we have a system to do that early next time, and making sure we do that well next time is going to be really important. So things like data sharing, so generating consistent, good data for when people are well and for when people are sick across all countries, that is shared between countries and can be used to create big bodies of information that have powerful, robust conclusions next time is going to help arrive at some sort of information or decision a bit quicker. And international collaboration. So people talking to scientists from all over the world talking to each other, sharing ideas, sharing findings, and teaming up to study together to arrive at conclusions earlier, and conclusions that are applicable to not just one population, but broad populations across the whole world. So I think those two things are going to be really important, or have been really important this time, and this is kind of a reminder of the importance to keep thorough databases even when things are good, and make sure we share those databases even when things are good, because when things get bad, and they will get bad again, we then already have this infrastructure in place, and this big data, this big collective database in place that we can use to figure out clear, consistent answers to problems faster.
Yeah, I think William's point on technology support is very great. I do agree with that, and I'm also very sorry to hear what's happening there. I think, ironically, in the COVID-19 pandemic, the most vulnerable people are the most likely to be hardest hit. So maintaining essential health service is vital to reduce additional deaths from COVID-19. And it was not the only case that we've seen with pandemic issues. We do see that problems also with chronic conditions like diabetes or something like that. The vulnerable people, the most vulnerable people are the most likely to be hardest hit. That problems is right in the fields of public health, and I think people in public health, some people tend to be the policymakers, and for the policymakers, they're facing a greater challenge today to make a multi-policy approach that adopt with multiple considerations like public health, economic resilience, and demographic risks, something like that. We cannot predict the health conditions in the future very well. So it's a little bit harsh to blame only on the policymakers, because there are some people who make the policies and some people decide what they want to obey. And I think the second key resolution to that will be to make sure that everyone understand the pandemic control relies on the community engagement and trust. So you have to first trust the people who tell you what to do, when to do, how to do, and then you need to actively engage in that to make sure your own safety. And if everybody can do that in a certain way that they feel comfortable with, I think there is a way to, fight this all together.
All right. So as we're thinking about resolution and moving forward, Yes, this may be the first of many pandemics in our lifetime, and that's a scary thought. But I was hoping we could end on a note of optimism. So I'm wondering, what inspires you? What gives you hope?
The amount of collaboration that I've seen from afar has been pretty exceptional, and scientists and politicians and people in all fields and from all walks of life, from all countries and of all nationalities, working on one problem together. Seeing how different governments have responded as leaders has revealed a lot of really optimistic or kind of positive lights for me as well. So people like Jacinda Ardern, who's the leader in New Zealand, she's kind of had a very humbling, powerful approach to this as a leader, and has portrayed herself as a person of the people and a leader with the people, not a leader in front of the people. And so seeing how different leaders, she's done that by making sure she regularly sends, posts videos of herself updating the New Zealand community, what's happening, making sure all the restrictions that are imposed for New Zealanders are also imposed for her. And that's been, I think, really empowering and reassuring for New Zealanders, and a good example for other people, in different countries.
You can look at things in different ways. So I think during this pandemic, a lot of people do understand better about how easily a man can be bitten by a disease and how much can the medical care help. This inspired a lot of people to pursuing their way on public health and medical service. And I think for those people who generate this inspiration and enthusiasm, the society will become more, a general respect will be generated from this pandemic to those medical providers. And it will be a bright future right there in the corner someday, that we have more people will like to give their valuable life and time in medical service, and we have the society to respect them very well, and we have people to trust their doctors, trust their medical community service to give the help that they need. I think only by undergo a whole tragic altogether, people can have this cherish and all together, and try to bear that in mind, and try to remember the days that we all in this pandemic and all very panic about what's in the future. And some people are come to the front line and save you out of this panic, and you will cherish that. You will be very grateful to that. And I think in the long run, it's a good thing. We have to wait for that day to come. Yeah.
Well, thank you both for dedicating your lives to helping people become healthier. Thank you both again for taking the time and energy to share your expertise with our students today. Hopefully we can have a healthier tomorrow because of it. Thank you very much.
Thanks for having us. Thanks so much.
Thank you.
Okay.